There was one point where I even had all my mirrors covered in my apartment because I didn't even want to see the person I was.
When you're depressed, you don't want to do nothing, hardly nothing. Just close yourself in, shut the shades and stay in the dark.
If I go over 3 days of not sleeping, I get manic and I get unmanageable.
Like your thoughts are telling you bad things about yourself, that you're not worth anything, you are unable to live functionally, you don't have what it takes. Then you kind of get immobilized. I would be in bed for a couple weeks, but I wouldn't want to move out of bed. I would just want to lay there. I had no energy, no ambitions to get up out of bed. I had extreme paranoia. I lived on the 3rd floor of an apartment building, so it was really unrealistic to think that people were at my window. But I did think people were at my window and looking in my window. I would get very angry. The reason I get most angry is because I don't want to be labeled. I don't want to have a label following me for my life. Like anybody, I want to be normal. And when you know that you can't be normal because you got a mental illness that's holding you back from even doing what you really want to do, it hurts.
I used to ask myself, why me? That was kind of hard to understand why I feel this way. I feel nobody loved me, nobody want me around. I felt like people were scared to talk to me or come to me, but I was scared of them too. They want to eat, cry all day, cry all the time. It made me feel good that I locked myself in and shut the shades. But I know it's wrong for me to do that, but that's just how I feel. I didn't want no light or nothing on me. I tried to hang myself once. The rope broke on me when I tried to hang myself. So I woke up in the hospital. Somebody found me, so my daughter found me. I still cry sometimes when I think about it. I'm on this earth by myself. And that was very hard for me, because they'll call you crazy and don't know nothing about what the illness is about.
I had gone on vacation or a spiritual retreat with some women friends of mine and had my first psychotic break. I thought the birds that were flying in the tree were coming to bring me messages, and the birds were talking to me, and the wind was talking to me, and the trees were talking to me, and all of nature was just alive, like there were little, fairies or something, in the flowers, and they were bringing me all of this intense messages. It's like, oh, that's too much information. It's a false illusion for the manic side. Because you think everything is great, but everything is falling apart because you can't sleep, you can't eat, and it's just exhausting. I can't have all this run stuff. The thoughts are race. It's just like they're just zoom, and I have to say, no, stop that and take a deep breath and calm and center and say, okay, this racing thought is not a normal thing. I get tired. Like it's like I'm always having to educate somebody, saying, this is a condition, it can be treated, you can be stable, you can live a normal life with restrictions. You don't have to be slammed off into jail or slammed off into a hospital or institutionalized or anything like that. You can be out with people.
I rejoice at the successes of our clients.
Success at Mental Health Resources comes in many different forms. Each step is progress toward a better life.
Fish. I've been in this apartment for 8 years. That's a lot better than I was doing before I got in here.
MHR worked with Harry for several years, helping him reach his ultimate goal of living in the community and becoming an active member of society.
I think things would have turned out differently if I hadn't had somebody, because there were times that I was pretty helpless.
Our case managers, we're there to support people, put in the appropriate referrals, and encourage people and say, yes, you can overcome these barriers, because for a lot of our clients, it's scary to get better.
What's important for you and I to come up with are some goals.
Mental Health Resources meets clients where they're at and works closely with them on a comprehensive plan of recovery.
Maybe do some communities, volunteering. Okay. Maybe that might push me back.
And that's exactly what we're going to be doing, is taking some really small steps to help you get to whatever your goals are.
Okay. Yvette is new to MHR. This is her initial assessment.
So it looks like there are a number of areas that I think that we can work on together. Okay. The importance of the work that we do is we help people to be successful in whatever they want their lives to look like.
It makes me feel great. I feel motivated. I feel motivated to go out and to make the appointments, to take my medication, to try to learn more about it, as before I didn't really want to.
All right, see you later.
It's a holistic approach where recovery plans are as unique as each individual.
I think the best that I can do is to try to help a person really articulate what they want out of life, what their goal is, long-term, short-term, and to try to help them take steps practically to get toward what they want for their life.
One of Tom's goals is to be more healthy.
So she encourages you to cook your food at your home.
He's already quit smoking. Now he needs assistance getting to and navigating through his local grocery store.
I mean, it's a lifestyle change, and you're not...
Krista is helping him make healthy choices.
Nobody wants to die. I don't want to die either.
I don't want you to die either.
Our clients have been seeing a number of different places by the time they get to us, and no one has really seemed to have the time and sometimes the expertise to do what we do.
Hello, hi Harry.
The mission at MHR is to foster hope and recovery for those affected by mental illness. It's a mission lived out each day by every employee.
I'm very balanced, I'm very content, even quite happy.
Victorine has been working with Harry for several years.
We're gonna start slow, we're gonna move up.
Progress has been steady. Setbacks have been a reality.
Well, sometimes change is hard.
But throughout it all, life is improving for Harry.
She won't let you quit. She keeps you encouraged. She's ultimately dedicated to her profession. Without Victorine, I'd probably be still holed up in my room with the curtains drawn and, not talking to anybody.
How's everybody doing? Everybody doing okay today?
MHR also reaches hundreds of clients on a daily basis through the Seward Community Support Program.
It's incredibly important to have a place like this for our clients. It's a place where they can come and kind of feel like they belong.
Jana Berry, Program Support Specialist.
Hi.
Hi, how you doing today?
I'm doing great. How are you?
They connect and share at the drop-in center. This is also a place where MHR clients have access to services provided by professional staff.
But I can guarantee you, if I didn't have a place like this to come to, things would be a lot different for me. It's changed my life.
Mary runs an arts and crafts class at the center.
There's one of our ladies here that just went to the hospital from here today, and so I'm making her this bracelet. It'll be like a healing bracelet, because when I was in the hospital, she came and saw me all the time, and I want to pay that back.
She plans to put the words laugh, dream, and wow on her healing bracelet.
No one knows mental illness better than folks that are mentally ill. And to have people come in here that aren't doing so well and just see that the other members kind of encourage them and work with them is a really big part of the center here.
Did you have any homework from yesterday?
Nope, I did that at school and turned in.
You did? Awesome.
That's because I'm awesome like that.
Jessica credits MHR with helping to keep her family together.
I can go to sleep tonight thinking, I did what I was supposed to do. I got my little list accomplished for the day. If I do more than my list, I interact with my son better because I'm calmer and overall just a happier person.
She's more settled.
Calmer. I can laugh more.
You say grace.
Bless us, O Lord, for these thy gifts we are about.
As they sit down for dinner and do homework together,
So
12 times 4.
Jessica takes none of this for granted.
If I would have been down the same path that I was heading before they came into my life, we wouldn't be sitting here now. He'd be somewhere and I'd be nowhere. And that's the God's honest truth.
MHR impacts lives in so many different ways. When it comes to family members of clients, connections often run quite deep.
They just kind of enveloped him in and just made him feel safe and secure and made me feel safe and secure.
Colleen Hansen was so moved with how MHR helped her son Mike that she wanted to give something back.
That feeling of peace was just tremendous.
What started as a small idea of making holiday gift baskets for clients has grown into a massive undertaking involving more than 100 volunteers, making at least 1,400 baskets.
We're in it for the long haul, and it brings us as much joy, probably more than it does the clients.
Giving back is vital. Even though the services that MHR provides are reimbursed, there is so much more that needs to be done that is not currently funded.
The need for the client base is significant. Whereas the organization does an excellent job at providing service, there's always gaps. And to add a fundraising component to give the organization direct control over filling in those gaps would be terrific.
These are the people. These are the stories of mental health resources.
I mean, I could see a chance. I could see something there. I could see a light.
They let you come at your own pace. They assess where you are, they assess where they want you to go, and they gently lead you there.
I think of my son. I think of how challenging his life is. It's not a normal life. It's a really hard life that he lives. And he's really my hero in many ways.
If it wasn't for the help in the earlier times, I don't know where I'd be.
Don't cry, you're gonna make your makeup come off. Then you're gonna be all shiny again.